hypertensive client. He was under good control at rest, but during
exercise he wasn't in control.
Right. Does that make sense? I mean, that's kind of like what you'd be looking at. So if he's only on an ACE inhibitor for his pressure, we learned today there's a bunch of meds you can be put on for controlling your blood pressure, and he probably should be switched to one of them or a second one added. So that if he's out walking at the mall, going to a soccer game to watch his grandkids, and you got to walk a mile to get to the field or whatever, that, you know, he's prevented from having a stroke. You know, if you see that, somebody needs to make sure somebody with MD after their name knows about it and does something about it. Is that kind of what you would have expected because of what kind of we went through? Okay. So you'll see an EKG. Okay. You know, you'll see one that looks like this. Okay, during hyperventilation, what did he develop? Wide and bizarre, ugly little things that aren't normal. Where the R goes in one direction and the T goes in the other. What are they?
You said the R.
The R and the T went. Okay, what did he develop here? Okay, so here's a normal PQRST. Now he's got a widened one where the R went up and the T went down. It is a PVC. So he got PVCs during hyperventilation. So you need to watch that, right? So those kind of things. Okay, you look at this stage, stage 1. You're going to look to see what's going on with his STs. How are they looking? Okay. Stage 2, stage 3, you know, you can see there's ST segment depression going on there. You see a lot of wiggling because of the way people are prepped and things go on, and that's pretty typical. Okay.
So I have a question. With the artifacts that you could get from a stress test, how are you supposed to interpret what's artifact and what's an actual abnormal change? Because I know on mine that I did, I thought they were abnormal changes, but it was just artifact, and it was hard to distinguish which is which.
Part of that is all just due to prepping,
Okay.
and in most cases we would hope that, you know, that gets corrected, but it doesn't always, and so it's pretty much up to that person with MD after their name to figure that out.
Okay, so there won't be any like tricky stuff like that. With like on the EKGs you give us, like we won't. It'll be pretty clear what's what. Okay.
Okay. Yep, like that. So I have a few of those all put together, and then like one that might say, "This is a person with blah 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 blah." List some of their risk factors. So fill in that blank. So if you see hypertension, male over, you know, male of 70 years of age, like with that guy, that kind of stuff. Put them in that way. So some will be like more fill in like that.
Wait, so there are going to be other fill-in questions and stuff?
There'll be different kind of scenario, like different scenarios. Some will be more like identify all those risk factors instead of just doing an interpretation of the whole thing at the end. To kind of make you think, oh yeah, this is what was wrong with them or her. Right? So you have 3 like that. And then those 7 calculations.
How many will it be like the one you just showed?
3 whole cases.
3
like
whole
that.
cases like that? Wow.
Similar to that. Yep.
How long do we have to do this?
Class.
How long is this class again?
Hour and 15 minutes.
Oh, that's not enough.
Oh, come on.
Can we have the last 15 as like a group discussion over that? Because we're going to be working with other people when we get out in the field.
Listen to her. Listen to her. You should be able to identify those things. I don't think you're going to.
So if we were like emphasizing studying, it would be more like the risk factors and the medication and like the EKG and calculations, and then all the other notes is just like, look it over, but it's not.
Yeah.
Okay.
Just to see, you know, did they do, you know, to know what a PVC is, you know, did over rhythm change during the stress test, you know. If they develop 3rd-degree heart block in stage 2, what would that be? Reason to terminate the test, right? That would be an indication. Well, if somebody goes into heart block on you, what do you think? If all of a sudden the
No, I
rate
know,
drops
but
to
I have to
40.
be able to ID it off the EKG. and
Yeah, I'm
it's
gonna have to
been a
go
while.
back to the.
I finally figured out what that was. Like I don't know, for some reason I thought that like the P waves are all normal, but the R waves were irregular. But I went to review the things at the end of the EKG book from the last book. You know, the cars, the little cardboard one. I was reviewing those last night, and I found out that they're both even, but they're just at different rates. Like, I didn't understand. Like, I understood. Like, when you read it, it says that, but I really didn't know what they meant until, like, I was like, oh, okay. The P's are regular, and then the R's are regular, but they're just not, like, how it should be, like a PQRST. Like, it's not like that.
Does everybody still have like something from rhythms from last semester?
I
Yeah,
still have the book.
Yeah.
I can look over the notes.
Everybody's got them? Then you can use them for the test. You can just bring them with you.
Oh, serious?
So
Even
much
if we don't
help.
No
have the notes,
discussion.
even if it's thick,
No, but if we have
notes
some-
from last semester.
You
And
can
the
bring
book's
them.
good?
If you think you're going to have time to look through all those and something that trumps you, but don't look for it to find the answer. Wait, you know, look,
Right.
Yeah.
spend your time efficiently,
That'd be helpful.
okay?
Can we bring the big book? Because the rhythms are in the big book
You can
too.
bring whatever you think's going to help you.
Even.
Really?
Wait, so we can use this semester's notes?
Yeah, you can bring whatever you want to help you. I'm giving you the calculations.
No,
you can
don't
use
tell
whatever
me
you
that.
want.
Don't tell me that. Don't tell me
Well,
I'm gonna bring
So if you
Stop
don't
it.
ace it, you should be ashamed of yourselves.
well, I know the rhythm strips.
Well,
I
then
just
you don't
feel-
have to bring that stuff, Jim.
Yeah, I just was testing myself last night because I feel like it's necessary in like this and some other classes. But
We'll do practice case studies and bring those
You're going to
along.
use this for real. You're going to be going on that. They aren't going to use that. You know, it's not really something the next part where you're really figuring out something for a client.
I'm excited.
Right. Somebody's going to
That's
like
what I'm
probably
looking
do
forward
the
to.
stress test and do the exercise prescription, but the other whole components to it and figuring it out and telling somebody that is more applicable, I think, to everybody. So I'm not going to freak you out over rhythms. You know.
so it's not the week when we get back; it's the week after
Yeah,
that.
it's after that, right.
Yeah.
You guys were
Like
all
2 weeks,
nervous
yeah.
Nellies about this, so that's why I brought that.
So when are we studying?
My last, I
Set it
have
over
a
to
question
break
here.
after.
In the syllabus for the reflection paper, it says it's a total of 5 to